Welcome to this UK-India healthcare collaboration, fighting pandemics together and investing in the future. My name is David Stringer-Lamar, Chairman of the Institute of Directors, London region. You've got a poll just come up on the screen in front of you. If you would kindly fill that in. You've got about 20 seconds, then it will be disappearing. It's just to give us an idea of what's occurring. Similarly, please, down in the chat, if you would like to put in there where you're actually joining us from today, India, England, Scotland, Germany, wherever it might be, just put it down there. That'd be great. That poll's probably finished now, so if you can take that off, please, Vanessa, put up the next poll. There gives an idea, panelists. So digitalization of healthcare is number 1, number 2, labor and training. And then if we can get the next poll up, please. It's all a bit quick, but we're on a very tight schedule. So the next poll will be coming up. And if you'd like to fill that out, please. And today, of course, it's very exciting for the Institute of Directors to partner with FICCI and IPF. And we're very much looking forward to hearing from the leaders of those august organizations. 20 seconds, please, and then we'll take that poll down. We've got people now feeding into the chat about where they're coming from. While I do that, Vanessa, if I can just hand over to you, please, just to take through a bit of the housekeeping and the engagement. Before I do that, just remember, everybody, this is a recorded session. So you're aware of that. Should you not wish to be recorded, then unfortunately, please cease from being a member of this event, which I'm sure you won't do anyway. Vanessa, over to you.
Thank you, David. Welcome, everybody. I'm Vanessa Dal-Busco from IoD Central London Committee. Please let us know where you're dialing in from today by typing in the chat box. There are 3 ways you can engage today. Many of you have already discovered the chat function. We recommend you change the audience to say all panelists and attendees so you can interact with each other too. If you have a question for the panel, please put it in the Q&A box. We recommend you use the Q&A function because we'll not be checking the chat for questions. So questions in the Q&A, chat in the chat. You should be able to like the questions that are your favorites. That makes sure we answer the questions that you want answered. Questions into Q&A, go in there and like your favorites. The final way to engage, watch the chat because shortly we'll be posting a link to a LinkedIn post. Please comment on that post to engage with fellow attendees. Once again, that link will be posted shortly in the chat and will be a great way for you to connect with each other by commenting on the post. Questions in the Q&A, interact in the chats, comment on the comments in the LinkedIn post. This session is being recorded. Back to you, David.
Great, thank you very much. And if you can give us the results, please, of that poll and put up the last one. So which area of collaboration has the most potential? Did we already see that one?
Sorry.
And then whatever the third question is, please.
Okie dokie. I'm just going to close that down.
Great, thanks very much.
Thank
and then
you.
If you can move us on to the next slide as well, just to keep you hands-on here behind the scenes, our excellent tech volunteers. So what we'll be looking at today in terms of the agenda, we'll have the welcome from our great friends IPF and FICCI, then the keynote addresses, panel chat, Q&A, and then a close down over the logistics. So it's all happening. So very much looking forward to the expert opinions and the considerations. There's the results. Do you believe that the pandemic has created long-term structural change to supply chains for the better? 90% says yes. It's now my great pleasure to hand over to Nehar Ratul, IoD City of London South Asia Group Chair. Nehar, over to you.
Thanks, David. Hello and good morning to everyone in the UK and good afternoon to everyone from India. My name is Nehar Ratul and I'm the chair of IoD's South Asia Group. Well, just about 6 months ago, the novel coronavirus, what we now know as COVID-19, was unheard of. Today, this highly contagious and dangerous disease has interrupted every aspect of our daily life, right from business to education to transportation. It has been nearly impossible to predict the pattern of the COVID-19 disease activity because the only predictable aspect of this pandemic has been that it's unpredictable. As the world economy is eagerly waiting to recover and get back to normality, the healthcare workers and scientists across the world are racing to develop a vaccine or discover any effective treatments on the virus. The webinar today will focus on the UK-India healthcare collaboration and has been organized in partnership with the Federation of Indian Chambers of Commerce and Industry and Indian Partnership Forum. The UK is a global leader in pharmaceutical research with decades of experience in planning and delivering healthcare services. India is the world's largest vaccine producer by volume and the largest producer of pharmaceuticals in the world. Together, these two countries have a deep relationship in healthcare. Whilst producing a vaccine or a drug to cure the virus is the main focus of the healthcare industry, there are some other issues which are of even more relevance, especially now, such as digital health, healthcare supply chains, and labor. What we have today is a truly accomplished and international panel of healthcare experts, both from the UK and India, and we also have a truly international audience. With no further delay, I shall hand over to Dr. Mohan Kaul, President of Indian Partnership Forum, for the introduction of our keynote speakers. Over to you, Dr. Kaul.
Thank you, Neha, and I add my words of welcome to all the participants and particularly to Dr. Sangeeta Reddy. I've been, it's some time that I met her in Delhi when we were working together under Sushma Swaraj was the minister and we were in a committee together. But thank you. It's a great pleasure to be working with FICCI and IoD on this important area of healthcare, which India and UK is already involved in a number of projects in this area and are likely to be getting more and more involved, particularly post-pandemic. I have a pleasure to introducing Dr. Sangeeta Reddy, who is the president of FICCI, but also is a global healthcare business leader, heading the Asia's largest healthcare group, Apollo Hospitals, and she would be giving Indian viewpoint in this, and she will be followed by Harjinder Kang, who is the Director of Healthcare and Life Sciences and Bioeconomy, who is heading the in the healthcare group in the Department of International Trade, and who will be giving the UK perspective. I hope he's already joined us, and if not, he will be joining soon. So without much ado, may I request Dr. Sangeeta Reddy to address us.
Good afternoon and namaste. It's a great pleasure to be amongst you today, and I would just like to say hello, good morning, and I'm just glad all of you are healthy and here. To our organizers, my co-panelists, and of course all the participants for today's, I think, quite significant discussion. The US-UK healthcare collaboration and coming together with a concept or a theme of fighting pandemics together and investing in the future clearly pivots around what's happening today and what we could be doing together. So I'm happy to share a few thoughts and look forward to the discussions as we go on towards the program. I believe it's important for us, two countries who are intrinsically linked in so many ways and have so much of a commonality of thought process, of operating systems and belief systems, to find ways to work together in healthcare. Identifying the complementarities and the synergies, I think, is an initiative which has been happening for quite a while now. And I do congratulate the India Partnership Forum and other forums who have been keeping up the dialogue. I believe that healthcare now enjoys a central position in the bilateral relationship between India and UK and has clearly been identified as one of the priority areas for the two countries to work more closely together. During the visit of our Honorable Prime Minister Narendra Modi in 2018, the two governments actually did formally agree at the highest level to step up health partnership between UK and India. The intent of the partnership for cooperation in the third countries was really aimed towards improving healthcare and finding methodologies where we could impact each other better, whether it was in training, development, education, medical research, setting up state-of-the-art facilities, extensive technology or innovation links. And I believe now a lot of work in terms of AI should definitely be added to this whole discussion. At that point of time, UK set aside, I think, announced a $2 billion project of the Indo-UK Institute of Health, which envisaged 11 medicities, 1,000-bed hospitals, 5,000 clinics, medical education. There were also plans to set up over 5,000 diagnostic centers using NHS expertise, equipment, and suppliers. And it also included, the plan had an ambitious outlay for over 11 medicities. So I think we're excited to understand and explore more. A more modest but equally significant announcement was £1 million on artificial intelligence to support India's national health program and UK-based companies to really look at innovative healthcare technologies and participate in this project. So I think an ambitious roadmap was laid out and various aspects were being worked at. However, in the meantime, I believe that all of us have been fairly preoccupied over the last 6 months. And while it's been a significant disruption, some sad loss of well-known and loved people, multiple anxious moments as we went through this, there's also been an underlying learning. And those significant learning moments, I think, are important for us to really say, what have we figured out? How do we consolidate the learnings and strengthen the synergies that we have, but also strengthen our resolve to work together to build a better healthcare system for the world? And it is in that thought process and in building the 4 pillars of universal healthcare, of access, of quality, of affordable healthcare, of using technology, which I think we should spend our time, our effort, and apply our imagination towards win-win solutions which can impact both our countries as well as the world. It's important for the world to invest more in healthcare rather than sick care, to focus on prevention. And while all of us are now preoccupied with the corona pandemic, I think a pandemic of equal proportion, if not more, awaits us and has been silently growing in size and proportion, and that is truly the pandemic of non-communicable disease. So that's why I reiterate, we should find a model which focuses more on healthcare, which is designed based on these preventive principles. I think that 1 out of 5 doctors and 1 out of 4 dentists in the UK are of Indian origin, and many of them are 2nd and 3rd generation who did their medical graduation in India and came to the UK, who have a passion and a love for the country of UK, as well as a connectivity with India. India's young pool of medical graduates and nurses are also keen to explore and find pathways and models. We've worked with various of your organizations, whether it is Health Education England, and I think Jed Byrne is coming later to speak. There's Cambridge, and I think Cambridge, and all the outstanding and most venerated institutions of learning that many of our students come to. We look forward to strengthening that relationship. And of course, in the aspect I did mention Cambridge, our Prime Minister did pledge about £15 million to Gavi, $15 million to Gavi for the Vaccine Alliance. But we look forward to Cambridge having success in your pursuit of a vaccine against COVID, and also in India partnering you in terms of manufacture scale with the ultimate goal of reaching this vaccine into everybody's hand. And as the 4th largest producer of vaccines in the world, India has a critical role in ensuring that we manage to immunize the whole world. I think we seek bilateral cooperation. We look forward to further strengthening of the vaccine task force. We are prepared to help in any way in enhancing the success of the corona vaccine, to play a role in the validation of this vaccine, and also in any other role that the UK believes India can participate. We have already provided paracetamol on the request of the UK government. I think we're working closely with the High Commission. So there are strengths on both sides. There's an intent to participate on both sides. But I think I must talk to the point that all participants said was the most significant, and that is the digital health area. So from our own personal perspective, at the Apollo Hospital Group, we quickly rolled out our healthcare app, and the app had over 18 million downloads of people taking the Corona Risk Score. We've begun to significantly collaborate in terms of the way we're doing teleconsults, and many of our 7,000 doctors across the Apollo healthcare system shifted to teleconsult, and at a national level, the same happened. The country has about 700,000 doctors, and in the last estimate, we saw that more than 20% of them were engaged in online teleconsult. I believe this capability, this skill set, which always existed, but the adoption, which has accelerated in this time of need, is something that we should build upon to build a more collaborative ability for us to serve other parts of the world. So if my time is coming to an end, I will conclude by just saying that I visualize a young India taking care of a graying world, a collaborative partnership of knowledge, a sharing of data so that we accelerate the time for which we bring out novel solutions. And I also, one word on the supply chain. India has currently ramped up its capability in masks, in ventilators, and just PPEs, for example. We are currently manufacturing about 400,000 PPEs a day. So we would look forward to collaborating on creating the standards, on understanding the supply chain, and participating and fulfilling a cost-effective supply chain for your country. I believe this is just a brief insight into the many things that we can do together in the pursuit of a healthier world and a more collaborative humanity. I wish all of you safety and happiness. All the very best, and namaste.
Thank you very much, Dr. Sangeeta Reddy, for your statement and number of initiatives that you suggested, which we will be working on in the next future months. And I have now the pleasure of introducing Harjinder Kang, who is here. I can see him, who is the Director of Life Sciences, Bioeconomy, and Healthcare in the DIT. He has had an experience in AstraZeneca, in NHS, in all the private sector and public sector, and is now on a policy role. And Harjinder, is the first time we're seeing you in this, and good to see you here, and we hope to work with you and your colleagues all the time. And over to you, and welcome.
Thank you very much. I'm sorry I was late on the call. I was actually in a meeting with the Permanent Secretary about some of the discussion we're having now, so it's all very relevant. But thank you very much for the opportunity to speak. Very grateful, especially for the comments that Sangeeta just made, because I was involved in some of those interactions over the last 3 months or so. But you know, the UK has been through a very challenging 4 months, as you will all have seen, and India is facing exactly the same dilemma in many ways. And obviously, we as two partner countries have been working very, very closely to try and help overcome this global pandemic. And quite frankly, there's been some very good initiatives that we've done together already, and there's a lot of space to do that going forward. Specifically, I was asked to say, well, how has the UK responded to the pandemic, and what can we do going forward to try and make the case for industry, government, academia, healthcare institutions to, you know, join hands and become stronger by doing that. And that's something I'm very keen to do. Let me just talk about some of the things that the UK actually did when it came to the COVID-19 pandemic. It was pretty clear early on that this was no usual flu season. It was no business as usual in any way. And the Prime Minister very quickly made all the departments within Her Majesty's government very, very clearly aligned to the COVID-19 effort, whichever, whether it was DIT, Department of Health and Social Care, whether it was the Foreign Office, you name it, every single department aligned behind an activity base which I've not seen before, and so unified as well. But the thing that really got me was it did feel like a war front and a war footing, in that how different parts of the UK, whether it was government, whether it was the academic institutions, whether it was industry, all came together at the time of need. And whether it was people making food and making sure food transportation across the country was still enabled. It was those sort of things which made for this to be a transformational activity. But let me give you some examples of the things that caught my attention. My old company, AstraZeneca, where I was almost 30 years a veteran of, has essentially taken on a very lead and key role in the whole vaccine situation. And they've obviously partnered with Oxford University, as we all know, and they've also partnered with the Serum Institute of India. So it's a global effort. It's not just for the UK. And certainly the UK's position on this is that this is a global effort. It can't be just for one nation. And we're very, very clear on that side of things. There's also the therapeutic options and effectively repurposing current drugs to see which could be actually active against the virus once people are infected. And a lot of academic industry collaboration is going on, more so than normal. The new world was always around collaboration across the boundaries, but this has really accelerated things. The healthcare system itself and how it responded to the challenge was quite something as well. I'm the vice chair of a national health service unit in the Midlands, which looks after the healthcare of about 1 million people. And effectively, they had to convert pretty much the whole National Health Service to respond to COVID-19. And that was quite an effort to expand the ICU capability, to create temporary, what was called Nightingale hospitals, because the thinking was there'll be such a requirement for ventilated ICU capability that temporary hospitals were springing up across the country, all just in case, rather than it actually happened, but better that than the other way. The National Health Service's primary care sector came into its own in terms of looking after a significant section of the community that could not go to see hospital doctors as such, who were busy looking after very ill patients who got infected. And then the whole purpose of, we've touched on it earlier slightly, in the digital capability that's now erupting across the planet, but certainly in the UK, we won't be going back to a pre-COVID-19 world, that's for sure. A lot of the primary care consultations, people did not go into their doctor's surgeries. It was all done over video calls, and it worked extremely well. And that is, as a model, I think going forward will be something that we can obviously all learn by and share to see what capabilities exist in the UK, in India, and can we actually collaborate to make those sort of primary care offerings even better, and how are they executed, and how can we make best use of very scarce resources in terms of trained physicians, nurses, and healthcare professionals generally. So that's something which I thought worked really well. And the final piece is around the rehab side of things in the sort of COVID-19 pandemic management, that a lot of patients actually, once they moved out of hospital, did need a lot of post-hospital care in terms of rehab. There are some seriously ill people with, damaged lungs, which will be a longer term situation, not just one you just...
1 minute, please, Arjinder.
Okay, thank you. And then essentially, I think the final piece I would really talk about is public education. I think the government did an amazing job in ensuring that people knew what the disease was, what to do about it, all about social isolation and distance keeping, and the use of various ways of keeping yourself isolated from your families. It took a lot of effort by everybody, but it was worth it because the disease is now under containment. And now what we do going forward in terms of allowing people to go back to daily life will determine just how successful that lockdown period has been. So in summary, I would just say I've been very grateful with what the Indian government did with respect to the ICU drugs, paracetamol, and now PPE discussions that we're having. That it's really good that the partnership has helped help the UK case, and we will hopefully carry on the collaboration to help India through its difficult time too. And with that, I would say thank you for your attention and best of luck all around.
Thank
Terrific.
you.
Thank you very much. Dr. Mohan, do you want to say anything?
Yeah, I just wanted to thank Harjinder, but also acknowledge the presence of Mani Singh, who's the economic minister at the High Commission of India, as well as Rohit Wadhwana, who's the counselor, and they are here and have been extremely helpful in getting this event off the ground, and also working on this UK-India partnership in the healthcare. Over to you, David.
Great. Thank you very much, Dr. Mohan. Excellent speeches there. Thank you very much. We're now going to move into the panel speeches from the panelists. They all have 3 minutes, so a super tough job, or 3.5 minutes. We'll be super kind to them. Just with respect to the questions and answers, the questions are going in there, but you can actually vote for them, which will actually move up the ones that you consider might be the most pressing for our people to answer when we get to that particular stage. Moving forward now then, it's now my great pleasure to invite Howard Lyons, CBE, former Managing Director, Healthcare UK, Chair of the Indo-UK Institute of Health, Health and Board Director of ICMDA. Over to you, sir.
Thank you very much indeed. I'm trying to cover in 4 minutes 3 items I've been asked to look at: training programs for healthcare workers, Indo-UK. Secondly, digitization of healthcare Indo-UK. And finally, the challenges and opportunities of rolling out NHS capabilities in India. The ICMDA, which you can see at icmda.net, is headquartered in the UK, but has 84 countries represented with over 60,000 doctors. And we're involved in supporting those organizations around the world, and have a particularly close relationship with CMC Vellore, which I'm sure most of our Indian representatives are fully, or Indians on the call are fully aware of. They've been a long-term partner of ICMDA. In fact, Vinod Shah, who runs the distance education unit at CMC Vellore, was the previous chief executive of ICMDA. And they have developed with ICMDA a diploma in family medicine, and have now linked up with the Tata Foundation and ICMDA to do online training and mentoring in COVID-19 for hospitals throughout India and with ICMDA across the world. The intention, if I could show the slide of the connections, which shows the representation and the links that CMC has in India. The intention is to train 5,000 staff in the next 6 months on emergency recovery and resilience in facing the challenges of COVID-19. We'll be providing training, providing HR support, and the proposal that we are rolling out between ICMDA and CMC Vellore is to spread that to a number of countries around the world. So the next slide shows the links that CMC already has with links around the world. We're doing a review at the moment of the needs of mission hospitals in particular in Africa and Asia, with a view to providing online training and support in providing drugs and equipment to COVID-19 challenged hospitals in different parts of the world. We'll be providing training in managing triage, managing quarantine, managing infection control, isolation, ICU, respiratory support, cardiovascular support and equipment management, and also how you manage yourself and your team. So that's a link between CMC, Valour and ICMDA to help those challenged by COVID-19 in India and in different parts of the world. The second point that I've been asked to speak about, and I'll speak about briefly, is the digitalization of healthcare. And certainly we're seeing through this link with CMC and ICMDA that there are great opportunities in low and middle income countries post-COVID-19. And we do believe that UK and India can lead the way. During my time as Managing Director of Healthcare UK, we did a lot of work in India, 2013 to 2016, to look at the opportunities to collaborate together. It was hard work, and I'll come to that when I look at the challenges in a moment. But essentially, we have achieved probably more, as Harjinder said, in the last 3 months than we did in the 3, 4, 5 years where UK and India were trying to collaborate together on digitization of healthcare. We see that there are going to be new cadres of professionals, telemedicine technicians are a good example, and we'll also see more use of support for home visits, which will be more productive, they'll be safer, and they'll be less expensive, both in the UK, but particularly in India. We see how digitization can reduce what we call in-hospital wandering, people wandering from one place to the other to have their patient history taken, to check in, etc., and to share their pharmaceutical information. So I think the time has come. It was reflected in the survey at the start.
1 minute, please.
Digitization of healthcare is the big opportunity. And then finally, you saw that I was chair of the Indo-UK Institute of Healthcare, and we did look at how we could roll out NHS capability in the Indian subcontinent. And in particular, we worked with King's College Hospital and NICE, because in areas of governance, I think the UK has got a lot to offer. We can also work together on remote diagnosis. We can work in manufacturing of equipment for blood glucose oximeters, blood pressure, etc., for the small items that will be used in healthcare in the home. But also, because we've got so many UK Indian doctors, there are opportunities for Indian doctors to partner in their country of origin. Now, the challenges, very briefly, cost differentials, obvious. The bureaucracy, we found that a real struggle at RUIH, and that's bureaucracy at this end as well as in India. And then the lead times, everything seems to take so much longer. Hopefully, the effect of COVID-19 will be that things actually happen much more quickly, particularly with digitization of healthcare. Thank you.
Great. Thank you very much for those comments, and thank you very much for covering so much in such a short period. Most appreciated. I'd now like to invite Shobha Mishra Ghosh, Assistant Secretary General, FICCI. Over to you.
Thank you, David. You're making me nervous, so I'm going to straight away get into the, my speech. Well, good morning, everyone in UK, and good afternoon in India. I was asked to talk about what were the pandemic learnings, how did the healthcare in India manage the pandemic, and what are the opportunities that have emerged for healthcare, medtech, and pharmaceuticals. So because of the diversity in our country, our learnings on the pandemic were very different for different states. What lockdown did was it helped to slow down the spread of the virus in the country. However, there were some states that managed very well, and there were some states that had challenges that they had to deal with. The first strategy was containment, testing, and tracing. Currently, about 1.5 lakh tests are being conducted each day through a network of almost 877 labs, out of which 637 are government labs and 240 are private labs. Rapid response teams for surveillance have been put in place. Health infrastructure upgradation to prepare both public and private hospitals were done with separation of COVID dedicated hospitals or wings, COVID health centers, converting hotels, hostels, schools, etc. as quarantine facilities. And in fact, the railways came forward to actually donate their railway compartments to convert them into isolation wards. And there are several such innovative methods that were used. Then, of course, there was the case clinical management and community engagement for effective management of COVID-19. And I think the most important part was empowering the community through robust messaging and advisories on precautions needed for COVID. Interventions are being planned at micro level, taking into consideration socioeconomic variations. Having said this, some states like Kerala have done phenomenally well, particularly because of the public health system that they have, and the decentralized strategies and the awareness and sensitization of the community which they did. In India, concentration of COVID cases has been in 5 major metros actually, and however the migrant workers now going back to the rural villages may contribute to the spread in rural areas. When we come to how did the healthcare sector manage, our large socioeconomically diverse population has been a key challenge in the pandemic management. The focus is now being shifted to control transmission with the objective to slow down its spread through gradual opening of lockdown, minimize the mortality through increased testing and early detection, as well as protection of vulnerable populations, especially the elderly. Human behavior is critical to manage this disease, so there is a focus on risk communication strategies through increased community engagement. And FICCI has been doing has been engaged with the government very closely in coming up with, recommending strategy papers, in actually giving detailed models of COVID care, how it can be managed, coming up, recommending HR strategies, COVID containment strategies through various roundtables of stakeholders, and we are very happy that the government has been paying attention and being cognizant to what the private sector has been responding. As far as the opportunities that are there for the industry, the COVID-19 pandemic has definitely created, unprecedented disruption for the entire health community, forcing the government as well as the industry to rethink, restructure, and reform. In fact, the entire supply chain disruption was a major challenge for even keep the continuity of essential goods, the flow of essential goods into the country. And FICCI actually
1 minute, please.
Worked very closely with the government in resolving these matters. The opportunities that, and there is a joint economic trade committee, JETCO, which is led by MOCI, the Ministry of Commerce in India, as well as the DIT in UK, and supported by FICCI and UKIBC. And the opportunities that they have, jointly looked at has been strengthening the healthcare infrastructure. So the opportunities that are there within the this thing for UK and India has been PMJ in India and NHS in UK have plethora of opportunities, and what the workforce task force has recommended that there should be a joint central portal with listing of opportunities on both sides. Then there are opportunities for joint pilot in rural India on primary care and telemedicine pilot in the UK, which the Indian companies can do. Then develop a platform for exchange of best practices in advanced medical delivery mechanism, and invest in patient data management for further analysis of efficacy of drugs and medical devices. India has marked itself among one of the prominent medical value travel destinations, and with the elective surgeries being put on hold in UK, this is going to convert into emergency, and the Indian healthcare can actually come in and provide teleconsultation, as President Vicky already has mentioned. So there is an opportunity over there, and also for the UK patients to come over to India for treatment. However, there is a need for looking at the 3-hour flying time, which is a kind of a trade barrier, which needs to be looked at. And given the importance of standards of growing trade, the two governments could also look at ways of aligning standards, including in highly regulated areas of medical devices and pharmaceuticals, for mutual recognition of conformity assessment by developing a UK-India mutual recognition agreement. This will reduce the overall cost and turnaround time of obtaining approvals and help companies to be more competitive in a wider market. A strong, harmonized IP regime with tighter legislation, proper enforcement, and speedy resolution across all industry sectors is essential for India and UK. Supporting innovation in healthcare is essential to ensure that affordable, effective solutions are found, innovation is encouraged, and global challenges are met jointly together. Thank you so much for your patience.
Excellent. Thank you very much for your comments. Very interesting to hear all about what's going on, empowering the community, communication, etc. I'm very pleased to hear that Vicky is effectively engaging with the Indian government. So well done to you and your organisation. It's now my pleasure to introduce and welcome Professor Jed to address us. Over to you, Professor Jed.
Thank you very much indeed, David. And I'm deeply delighted, if a bit perhaps out of place in such an esteemed array of speakers. My name's Jed Byrne. I'm a surgeon by background, and I'm the Global Director for Health Education England, which is the executive arm of the Department of Health responsible for health workforce. Prior to COVID-19, the biggest issue facing effective universal health coverage in emerging economies and low and middle income economies was the quantity and quality of the healthcare workforce. The WHO estimated that there was a shortage over the next decade of somewhere between 14 and 18 million healthcare workers, which is probably an underestimate. Post-COVID, that situation, I would argue, has not changed. If anything, it has exacerbated. Immediately prior to COVID, migratory pathways had been increasing and been facilitated to allow the pursuit of personal development to be a real driver in ensuring that healthcare workers learned within a global environment so that they could deliver a higher quality of care when they returned home. COVID-19 undoubtedly, despite being a terrible tragedy for the globe, has produced an enormous amount of new opportunities. People like myself, born at the beginning of the era of Generation X, have suddenly become digitally native and woken up to the idea that technological solutions to some of those workforce issues have been available for some period of time, but not embraced by those people who have led healthcare development and health system strengthening. There is a real opportunity for dual investment in both undergraduate and postgraduate education and training. I think the barriers to joint Indo-UK undergraduate schools with joint accreditation in medicine, nursing and allied health professional training, I think are being removed. I think the notion of the development of global universities where people learn about knowledge transfer and knowledge assimilation, but learn the clinical side of the health professional practice locally is now ever more possible than it was before, and more necessary because of the downward pressure on local training and on international travel. I think the advent of high quality technological learning, particularly within virtual learning environments and virtual reality, as well as robotic learning, offers a real opportunity for education, training and workforce development to take a step change for the better and make it more fit for purpose, I guess, for the next 50 years. There are specific set of other opportunities which are emerging at the moment. Our partner higher education institutions in the UK who work and develop our healthcare workforce are particularly interested in bilateral research and innovation possibilities in the area of pharmaceuticals, pharmaceutical development, vaccines, antimicrobial resistance, and perhaps more recently, the whole notion of frugal innovation, where we are able to innovate within a low, middle or emerging setting and increase the value for money for healthcare expenditure when brought back to the UK. The final point I would just like to make in this very brief period is that as a point of personal learning, it has dawned on me and many of my Generation X colleagues that much innovation through being embedded and bathed in technology must come from the younger generations within our communities. And I think as Health Education England, where our responsibility is fundamentally to the NHS, we are committed to understanding the entrepreneurialism of our younger generations so that we can improve healthcare developments and health system strengthening bilaterally over the next few years. Thank you very much.
Great, thank you ever so much, Professor Jed. Good to hear the slant around education and the potential further cooperation between UK and India, and also the higher education, looking at bilateral research and innovation in the pharmaceutical, and of course coming from the Institute of Directors, music to my ears when you spoke about engagement with tech and obviously entrepreneurship. So thank you very much for mentioning those. I'd now like to welcome Dr. Murtaza to address us. Over to you, sir.
Yeah. Thank you very much. It is indeed a great pleasure for me to be part of this conference and to be a part with such esteemed panelists. My name is Dr. Murtaza Kurakiwala. I'm the Managing Director of Wockhardt, which is a global pharmaceutical biotechnology and an integrated healthcare company. We are based out of India. That's where we started. We are about 50 years old. Now we have operations all over the world. And our link to United Kingdom is fairly strong. And there since the last more than 20 years. We had acquired a couple of pharmaceutical companies in UK, one near London and one at Chester. And we have been in UK now for the last 20 years as a pharmaceutical manufacturing facilities, as well as in sales and marketing, more in the generic business. And we have products that are available with the NHS as well as the Tesco's and various other channels in the UK. Coming to the, in addition to that, we are also in hospital care, and we have 8 specialty hospitals in India, mainly in the western part of India. And therefore, I think that gives us a great opportunity to understand healthcare from a more holistic point of view and comprehensive point of view in terms of medicines, in terms of preventive health, and in terms of disease management and healthcare. I would like to talk a little bit about collaboration between UK and India in healthcare and some of the areas and opportunities that I see from an industrial point of view and from business point of view. I think one of the areas which India can offer to the UK is in terms of supply chain, in terms of manufacturing, in terms of creating cost-effective, high-quality medicines for the UK market as well as for other parts of the world. Our generic penetration in the UK market is fairly significant. In fact, in the US itself, 40% of products that are sold in the US, generic products that are sold in the US is manufactured in India. So we have a very strong supply chain in terms of manufacturing cost-effective, affordable, high-quality medicines. The area where I believe collaboration and can help India is in terms of research and innovation. I think this is an area where we can provide scientific prowess of the Indian community and UK advancement in technology, research, new innovation can be extremely helpful. Just to give you an idea, one of the areas of research that we have as an organization is antimicrobial resistance. And we are developing new chemical entities where there is antibiotic resistance. In fact, we have now 5 molecules which are in various stages of clinical development. We have a molecule that's going to be launched in India. In fact, it was launched last month. And one of the things that we faced is if there is more higher level of collaboration, funding, and innovation of research between UK and India, I think that will be extremely useful in terms of the collaboration that we can develop and in terms of the various ecosystem that can be developed in India. What is observed is outside India, in the West and in UK and in the US, there's an entire ecosystem of research that is there. And that is one area where a great amount of learning and a great collaboration with India is possible, where the universities, academics, industries, and the government and the stakeholders can all come together and create a very high quality innovation and research ecosystem. Coming to some of the aspects in terms of the other opportunity I believe that can be there is in the area of teleconsultation and telemedicine. I think the medical specialization of doctors in the UK and the consultation with high-end doctors in India can open up new channels of communication, and it can create a value on both sides in terms of clinical evidence that is available in the large population in India, as well as the scientific development and advances that are taking place in UK and around the world. And
1 minute, please. Yeah, please carry on. There's 1 minute to go.
Yeah. So as I said, I think this is the teleconsultation and scientific dialogue between the UK community and Indian medical community. I think that can be extremely helpful. And I think the whole COVID-19 situation has taught us that a lot can be done without physically being next to each other. And just how internet has changed the way we communicate and share data and information in the last 20 years, I feel the COVID-19 situation has really opened our eyes in terms of achieving so much without actually going physically somewhere and being where you are, but yet communicating electronically by Zoom, by conferences, by webinars, and all of that. And every time there is a disruption and a change, I think our eyes open up and there's something new to discover and to learn. And I think that is very exciting also in a way. It is also continuously evolving with time. And I think every change creates a lot of opportunities. UK and India have great opportunities, great connect, and a great history with each other. And I'm sure that if we put our mind to it, we can take it to the next level. It's a great pleasure to be over here to address all of you. And thank you very much.
Terrific. Thank you very much, Dr. Mutaza. You covered a lot of ground there in terms of innovation, and it was good. I like that phrase. A lot can be done without being physically next to each other. And of course, you spoke about disruption, of course, creates new discoveries and ways of working. So thank you very much for that. Right, we're going to go to the questions and answers. So I'm just opening it now. Let's see what is number 1 voted up. So to what extent are governments and financial regulatory systems fit for purpose in nurturing the correct and sustainable environment to drive condition prevention instead of condition treatment and outcome management? So to what extent are government and financial regulatory systems fit for purpose to drive condition prevention instead of condition treatment? Anybody would like to answer that from our esteemed speakers today? How fit for purpose is the system? Government and financial regulatory. Anybody from the panel on that one? Yes, please, Professor Jed.
Yes, I'll have a go.
Thank you.
I think the answer would be not very, but probably getting better. I think there is a general awareness and understanding that population health, health and well-being and prevention is key to unlocking some of the spiraling costs of healthcare and also managing some of the workforce deficiencies. I think the very often I think the terminology is something which is a barrier to us, and what we're actually investing in is a pan-system investment in maintaining health and well-being. From my perspective, as somebody focused on workforce, I'm very keen on empowering clinical staff to move away from being therapeutic experts into being health navigators and advocates for health and well-being. And I suspect that a lot of this change will not come from government, actually, it'll come from education.
Great, thank you very much.
Can I take a go at that?
Yes, please.
Well, I have a very different outlook to that. I feel that the change is not to be expected from outside us. It has to be internalized. And I think prevention is about our own consciousness and about the mind. We have realized in the COVID situation that gap between what we need and what we want. And we have realized that we can do a lot with a lot less. And sometimes the excesses that we have, or the desires that we have, or the luxuries that we have, really creates all the medical unnecessary issues and problems in terms of the lifestyle we have and the kind of pollution that we create. So I think it is a mindset, and if we are able to internalize the fact that, and this COVID situation has brought it to our consciousness, that we can do a lot more, achieve a lot more, and be effective with a lot less. And if we control our desires to that extent and control our excesses to that extent, I think we can be healthier also. And that is a prevention. That is a way we prevent things. Thank you.
Great, thank you very much. You will have already seen that some of the questions have been answered kindly by our panel. Unfortunately, we ran out of time, but obviously do keep the conversation going. You've seen the LinkedIn profiles. Just before I hand over, I would like to say thank you ever so much to Dr. Mohan, President of IPF, and also, of course, Dr. Sangeeta, President of FICCI. Hopefully, this is the first of many collaborations between our three organizations. I would now like to hand over to Sid Call from IPF.
Thank you, David and panelists, for a very productive and efficiently regulated panel discussion. I think we all got a lot out of it. I just want to very quickly conclude, I'm not going to take much time, to point out what seems to be some of the major themes of today's discussions, and what seems to dominate a lot of our talk has been issues around the exacerbation of supply chains and the opportunity to increase and collaborate on production and supply of medical equipment, the synergies that exist when it comes to investing in a demographic theme between a graying Western world and a young dynamic India, and innovating in that area, and as well as overcoming this, the very similar challenges, even though we have very different economies, but very similar challenges in primary care provision. And finally, what seems to be something that we've been doing a lot together, which is continuing to focus on labor, education, and training, and the research and development that happens in that area. What we've seen from these themes and taken forward and catalyzed, that they're taken forward and catalyzed by both private and public institutions. ICMDA, IUH, and WCAD are great examples of this, as well as what's interesting to see is what was mentioned in terms of PMJ and NHS work, and the similarities between UK and India in terms of corporate culture and public governance structures clearly help in furthering catalyzing collaboration along the lines of digitalization, healthcare systems, healthcare and pharma innovation and research, and finally, education and labor, which should be themes that also are going to develop as we approach the B word, Brexit, as we haven't mentioned here, we didn't have the time, but I'm sure it'll be in people's minds. My final word, we in IPF, in Indian Partnership Forum, we were founded with the support of the Indian High Commission and the UK government to promote collaboration. And there seems to be no more important area at this time than healthcare during these very difficult times. As Dr. Korakaza said, we've got to do a lot more with a lot less together, and we can only do that together. And we'll certainly be highlighting a lot of the issues that have been brought up of collaboration, funding, and research to policymakers, as we do here in the UK, and as I'm sure Vicky will do also, is their role in India. With that, hand over to Neha, I think, for the thank yous and conclusions, basically.
Thanks, Sid. So on behalf of IoD, I would like to thank our esteemed panel for sparing their time and sharing their knowledge on such an interesting and vast subject, especially very topical right now. I would also like to thank the audiences, both here and in India. I would also like to thank our partner organizations, FICCI and IPF, especially Dr. Mohankol, Dr. Pramsha, and Sidco for making this event happen. And finally, the IoD Webinar Task Force, who work very hard every day to put up these wonderful webinars for us. That's it for me. And for the upcoming list of webinars, Vanessa will show us the list.
Wonderful. Thank you, Neha and panelists. Big thank you to you, attendees. If you enjoyed today and you'd like to see more like this, please go to iod.com/London events. Loads of exciting events coming up every Tuesday weekly. Next slide, please, Jen. Next week, it's the China event. That's the 23rd. The 30th of June, though, International Trade is running a very special event with the Financial Times Chief Economics Commentator Martin Wolf, CBE, on global supply chain remodeled, which is a major theme from today. Wow, what a fantastic event that will be. Next slide, please, Jen. And there's a special offer for you right now. If you're considering membership, there are great benefits such as these events and a lot more. IoD will actually waive the joining fee for you. That's 25% off the full price, which is only £17 per month. What a deal. Email the address on the screen if you'd like to know more. Please join our fabulous community. Namaste, and back to you, David.
Great, terrific. Thank you very much for carrying us out there, Vanessa. Finally, from me, thank you to the great organizations that were involved today. I have personally learned an enormous amount of information. I can see there's a great bed of opportunity here between the UK and India in very many of the areas that were discussed. I also want to thank all the attendees from the UK, India, and indeed other countries for joining us here today. And I wish you onward success and, of course, health and safety in the current challenging times. Thank you very much.